I should mention, of course, we passed out of our Committee on Energy and Commerce just 2 weeks ago, H.R. 914, which would have, for the first time, increased the number of primary care residencies available. It was a self-replenishing loan program, oftentimes the biggest barrier to entry for a hospital that doesn't currently offer a residency program. The biggest barrier to entry is the cost for getting into that residency program. And last year's Congressional Budget Office said this bill was not a problem financially. Last year's Congressional Budget Office is this year's Office of Management of the Budget, and this year's Office of Management of the Budget says, well, wait a minute, if you make more primary care doctors, they're going to see more folks, they're going to send in more bills, it's going to cost more money, so we can't have that. So we've kind of reached a little bit of an impasse there, but I hope to get past that, and it just underscores sometimes the futility of working in this environment in which we find ourselves. Now, just a few weeks ago, I was fortunate enough to be asked down to the White House to participate in the Healthcare Summit, and President Obama, to his credit, as he was wrapping things up, said, look, I just want to figure out what works. Well, I am here to help him. I am so glad to hear him say that. He says the cake was not already baked. We would work through this in our congressional committees. He'll provide guideposts and guidelines, and at the end of the day, it's going to be a congressional decision. I applaud him if that's the case. I still have some reservations deep down inside that this bill has already been written in the Speaker's office, but I'll take the President at his word for right now, because after all, we are charged in the practice of medicine for following evidence-based practice. We are told to practice evidence-based medicine. Well, we as policymakers should also practice evidence-based policy as well.